We also got word today that Tucson Medical Center is at capacity. With our hospitals filling up quickly, people are asking if the empty St. Luke's Medical Center here in Phoenix could reopen.
In a word, this year has been exasperating for Tucson emergency room doctor Bradley Dreyfus, who's also a father.
I've got an 11-year-old. It's been very hard on our families, whether it's because we're not home or because there's major concern about getting our family sick.
This comes as some Arizona hospitals near capacity. You may remember back in the spring, Governor Doug Ducey announcing more than 330 ICU beds could be available at St. Luke's Medical Center. It never had to open, and the potential use changed. As Arizona's family has reported, if it was put to use, it would likely be a place for patients to continue to get care after they're released from the hospital. The issue now at other hospitals, staffing.
The key ingredient is staffing. You always hear both the state health department, the websites, and people in general talking about beds, but beds don't treat people.
The demand for ICU nurses and licensed respiratory therapists comes as nearby states also see a surge, and experts say there's basically a bidding war going on.
We're coming a little late to the game on this surge, which means it's going to be that much more difficult to get those specialized teams in place here in Arizona.
Meanwhile, Dr. Dreyfus is part of a group called HCW Hosted, which connects frontline workers with safe housing and more. As the pandemic takes a toll mentally, physically, and emotionally on frontline workers, here's his advice.
Mask up. Do not travel for Christmas holidays or New Year's holidays. Just please stay home.
Now, the state health department says that they don't feel like there's a need to activate St. Luke's. They say their focus is doing the same thing they would be doing there, which is getting people into licensed facilities where they can get that post-acute care.